Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help guide you through the Fugl or Fugl Meyer assessment. So what is the Fugl Meyer test? The Fugl Meyer assessment, or the FMA, is a test practitioners use to assess recovery in post-stroke hemiplegic patients and help monitor progress. More specifically, they check the following domains: motor function in both the upper and lower extremities, such as the movement, reflex, and coordination of the shoulder, elbow, forearm, wrist, hand, hip, knee, and ankle. This is in addition to sensation, balance, joint range of motion, and joint pain. The test itself has over 100 items and utilises a 3-point ordinal scale for scoring and can take 30 minutes or a maximum of 2 hours to complete. For scoring, the points are as follows: 66 points for the upper motor function in the upper extremity, 34 points for the motor function in the lower extremity, 14 points for balance, 24 points for sensation in both the upper and lower extremities, 44 points for passive joint motion in both the upper and lower extremities, and 44 points for joint pain in both the upper and lower extremities. There are a variety of healthcare professionals who can use the assessment, however, it is mainly used by physical therapists. Here's how to use the assessment effectively. The first step is to fill in essential patient information and tick the relevant checkboxes, calculating each score as you go. The second step is to assess all dimensions for each section. To conclude, calculate the total score summary and then integrate results within a treatment plan. To view a sample assessment of this test, feel free to visit carepatron.com where you can download and access it for free. No sign-up is required. However, you can also access it through our platform, filter by community and by assessments, and you can also type in the keywords to find the note faster. Edit however you wish and click Publish to complete. Thanks for watching, and remember to subscribe to Carepatron to view healthcare videos in the future.